Hey everyone, today we're talking about HRT, or Hormone Replacement Therapy. If you're approaching menopause or experiencing its symptoms, this video is for you. So, what exactly is HRT? Simply put, it's a treatment that helps alleviate menopause symptoms by replacing hormones that naturally decline in your body during this time. Menopause can bring on hot flashes, night sweats, mood swings, and more. And HRT works by replenishing estrogen and sometimes progesterone to help balance these things out. There are different types of HRT. Number 1, estrogen only for women without a uterus. And then number 2, combined HRT for most women, which includes both estrogen and progesterone. HRT comes in various forms, like tablets and skin patches. Each has its pros and cons, so it's important to discuss with your doctor which is best for you. A vaginal estrogen pessary is popular for vaginal dryness and manages local symptoms. And Evorel Conti patches is another popular treatment which contains both hormones estrogen and progesterone. Now let's quickly address the elephant in the room, risks. While HRT has been associated with slight increase in certain health risks, for many women the benefits outweigh these potential risks, especially when started before the age of 60 or within 10 years of the menopause onset. Remember, every woman's experience is unique. If menopause symptoms are affecting your quality of life, don't hesitate to talk to your healthcare provider or use our Ask a Pharmacist service on eSurgery to know whether HRT might be right for you. Thanks for watching. If you found this helpful, give us a thumbs up and subscribe for more health info. Stay healthy and take care.